Hi, my name is Amber Florian, and this is my quality improvement project, Improving Patient Satisfaction, Nurse 451. The reason I chose this topic is that it is not only one of our unit goals to increase our patient satisfaction as it linked to better health outcomes, but also to improve our hospital consumer assessment of healthcare providers and system service scores, or HCAHPS for short. It is a known fact by now that patient satisfaction is a key indicator of healthcare service providers' quality of care. And with the recent paradigm shift of fee-for-service model of reimbursement to hospital value-based purchasing program that measures and pay for quality performance, hospitals pursue high patient satisfaction scores. And so in order to promote this quality, I begin my PDSA Plan, Do, Study, Act change project with understanding what is exactly patient satisfaction. What are the current HCAHPS scores? What are the goals? And what are the possible causes for the current situation? Patient satisfaction can be interpreted in many ways as there is no consensus on one definition. Therefore, the HCAHPS survey evaluates issues ranging from communication skills of healthcare professionals to the cleanliness of the hospital. What is unique about this survey is that it is the patient evaluation that follows the provision of healthcare, as patient satisfaction means something different to everyone. Recent researchers have tried to understand it. It seems that it bears no clear relationship to the technical quality of healthcare, but rather it often addresses the humanistic aspects of healthcare, such as good communication, treating patients with courtesy and respect, compassion, concern, and caring. The HCAHPS is a national standardized survey which is publicly available for all to view and compares the patient experience of care at different hospitals in the United States. The survey includes 27 questions, and for the purpose of my project, I will focus on a few core questions related to communication with nurses. The following chart describes the component of the standard: nurses courtesy and respect, nurses listen carefully, and nurses explain things, along with the Centers for Medicare and Medicaid Services benchmark, or CMS for short, the national average, the overall score for my hospital, and the score for my unit, which is right here, 3CV West. And as you can see, we're less than the goal of CMS 75 percentile. Overall communication with nurses was 68.2, nurses courtesy and respect 82.5, nurses listen and carefully and explain things was a little bit lower. And this information was taken from the second quarter of HCAHPS scores for Good Samaritan Hospital that you can see right here. So in order to understand why our patient satisfaction scores are lower than the CMS benchmark in regards to communication with nurses, we have to examine the following topics that patients measure: delivery of information, caring behavior, and communication skills. Delivery of information. It is no surprise to find that patients were not satisfied when they receive inadequate information or specific information related to their illness, medications, and treatment. It is important to provide patient education as it can prevent readmissions soon after discharge and better patient care management. Moreover, the educational materials should be explained in terms that the patient can understand. Caring behavior. There is a strong link between patient satisfaction to nursing caring and nurses demonstrating caring behavior, such as reassuring patients, providing emotional and skilled support, comfort relief, being there for the patient, and respect and answering their needs. According to Gene Watson caring theory, transpersonal caring moments or caring occasions wherein the one caring connects with and embraces the spirit of the other through authentic, full attention in the here and now, and conveys a concern for the inner and personal meaning of another. Caring is challenged by factors such as technology-dependent environment, multicultural, and nursing workforce issues. Next is communication skills. Effective communication skills will not only convey respect for the patient, but they are also critical to the success of care planning, decision-making, and quality of care. Barriers to communication includes time pressure or workload of the nurse, which could contribute to failure to listen to the patient, understaffing, culture and ethnicity, language, patient routine-centered care, and distrust in the nurse's competency from reasons such as apathy, inexperience, and lack of attention. In addition, gender can affect communication styles, as women are characterized as being more collaborative in their communication, whereas men may be more direct and competitive. Other communication challenges include poor hands-off at shift change, varying communication style, personalities, and distractions. So who is affected by this measure? So for one, the hospital organization, as it measured by its quality performance, patient satisfaction, and is reimbursed accordingly by the government. Currently, about 25% of the total performance score is based on how patients rate their hospital experience. So that's a lot. The patient also, a recent study found that there is a positive relationship between higher HCAHPS and higher patient outcome scores. The community, the people, as a result of the survey are publicly available. It gives people a sense of being part of a community who participates in healthcare, promotes its quality, assess humanism, communication skills, and threats to patient safety and confidentiality. And of course, the unit staff. Staff morale increases as they receive positive feedback on their work. So my goal for this project is patient satisfaction scores in the domain of communication with nurses will improve and increases to at least 90% by August 6, 2018. The solution to address the standard of communication with nurses, I chose to educate our unit staff on the framework AIDED, which stands for acknowledge, introduce, duration, explanation, and thank you, and personal connections when communicating with our patients or families, including during bedside reports, and also ensure that our new care boards are being used accurately by nurses to communicate the plan of care. AIDED is a framework that provides healthcare workers tools to improve communication with patients, as it leaves nothing open for interpretation by the patients, and it aligns his or her perception with the organization. AIDED uses keywords that healthcare professionals use to connect the dots with their patients and families to better understand what they're doing and why. As I previously mentioned that communication skills of staff are affected by many variables, AIDED helps to level the playing field so everyone, no matter from which background he or she came, can offer a clear and concise communication. So in the next slides, it's a little bit about AIDED and what it stands for and how it can help. So acknowledge, the nurse establishes trust and showing empathy and refers to the patient by their preferred name. When the nurse introduces herself and the upcoming nurse who will be taking care of them, nurses can reduce patient anxiety. Duration, reducing anxiety by establishing time expectations. In explanations of care, explanation of care and using teach-back method to verify understanding. And also, of course, nurses should explain things in terms that their patients can understand. And thank you, building loyalty by leaving a lasting impression. AIDED will also be utilized during bedside shift report as it enables accurate and timely communication between nurses and patients, increases patient safety, and involves in the patient in the plan of care. The current literature shows that patient satisfaction improved when bedside report with the patient was done. Personal connections. One of the ways nurses can create personal connections with their patients is by showing them empathy, which will then foster a sense of compassion, caring, and kindness, as well as it will improve communication and understanding. One way to enhance empathy and behavior is to listen carefully to our patients and really understand where they're coming from. In addition, using the patient's affect as a focus to connect has been well described in the medical literature. Recognizing the emotion, articulate a response, and regulate one's own emotion are part of establishing a personal connection. My care communication board. Those whiteboards in every patient's room were found to improve communication in the inpatient setting, part because they provide a visual prompt during interactions with healthcare providers to offer more information or address patient concerns during rounds, and part because they are tools that nurses can use to explain things in terms patients can understand. They are simple but effective tools to improve patient satisfaction with communication and to engage them in decisions about their own care. Also, the goals that are written on the whiteboard should be patient-driven, such as going home, and not necessarily nurse-driven. Solution implementation. In order to implement the above solutions, my interventions were focused on staff education and validation, and the time frame lasted from July 16 until August 5th. I divided my time between staff education and attending nurse leader rounds. For staff education, I used the following aided checklist, which kind of go over more in details as for each stage. Bedside report presentation board, and kind of summarize the process of hands-off shift report. Validation of whiteboards, reviewing information for completion, accuracy, readability, and quality of information, such as goals. And the distribution of the importance of personal connections in morning staff huddles. Personal connections were also implemented during nurse leader rounds, where gaps between patients' expectations and the perception of the service they actually received are assessed. The purpose of the rounds was explained to the patients that it is a way for us to ensure safe and quality care is provided on the unit. To establish personal connections, active listening is needed, so when the patient gives clues about themselves, staff is able to develop that conversation, use emotions or humor if applied, and make the patient feel important and heard. Talking of hobbies, family life, pets, and anything that we can relate to the patients get us a little closer in efforts to build a trustful and friendly relationship. I was able to check off most of the nursing staff on aided, and the majority of them proved to be solid performers, meaning practice and skills development was only needed in 2 to 3 opportunity areas. Personal connections were felt to be something that they do anyway and would not interrupt their workflow, but did admit that it was a good reminder of what they should and shouldn't say. And overall, having the awareness that a nurse leader rounds on their patients and assess the quality of care given, the staff was encouraged to do their best, specifically when communicating with their patients. So the results of the current quarter show significant improvement of nurses' communication with patients, and although we have not reached the goal, we feel that we are on the right path. As you can see from this data, the third quarter, 3CV West scored 86.4, and to remind you of the previous quarter, we only received 68.2. Nurses treat you with courtesy and respect also went up to 86.7. And more significantly, nurses explain in ways that patients understand and listen carefully went up as well. Although it's less than 90, having scored above the CMS benchmark is great, as hospital reimbursement is tied directly to patient satisfaction scores. And so leadership efforts will continue to focus on staff education, which includes aided, and have this competency revalidate in annual skills day. We educate charge nurses to seek a personal connection from the nurse prior to rounding on the patients. My care boards are to be updated and accurate in all patients' room. The goal is 100%. And bedside report, nurse leader will observe bedside shift report are being done. I hope you all enjoyed my presentation, and I thank you for your time. The next few slides are the references slides. Thank you so much.